About 3 months ago, I hurt my back bad, and I was barely able to go from sitting to standing position. Fortunately, I came out here to Rehab Associates of Central Virginia and hung out with this guy. This is Dr. Andy Tatum, and I thought I'd tell you my story today because a lot of us deal with back pain, and you see a lot of folks with back pain. Let's talk about my story. What was wrong with me, man?
Well, if I recall, you were being a little overactive and pulled your back, and that's a very typical scenario we get. And when you come in, there are a lot of things that can cause back pain. It can be joint issues, it can be muscle issues, it can be the way you do things. But for you, I think you were dealing with a little bit of everything. You're a hard worker, and I think it just caught up with you.
Right, and I was trying to do that high impact sports kind of thing too. And I've had problems with my back before, and coming to you all, you made a lot of difference, and you pull in the medical side of things but also the strength training side of things. Right. Tell us about how Rehab works and how you all think here.
Well, what we do is we follow a treatment algorithm, basically practice-wide. It's based on research, and we found that using the 3 tenets of evidence-based practice, that means available research, patient preference, and clinician experience, we get superior outcomes. And truthfully, compared to our outcomes internationally, we rank in the top 5% of folks or practices as far as treating low back pain.
That's amazing. And this particular location, and you have many area locations, right, has a lot to offer whether you have back pain or other types of pain.
Right. We have 5 clinicians here, and because of that, we have the ability to subspecialize. I subspecialize in spine and facial pain. My partner, John Wallman, specializes in sports, knees, and shoulders. We have Mary Wallman specializes in vertigo. We have Dr. Tuba Bayram and Dr. Mona Fazina. They specialize in geriatrics and fall and balance prevention.
And you also have a pool here, which I just want an excuse to go swim.
We do have a therapeutic pool, which is great. We use it everything from ankles to necks, which is wonderful. You can go ahead and get someone in a reduced gravity environment so they can do many things in the pool that they can't do on land. We also provide some dry needling techniques for any sort of muscle issues.
And I actually got to be part of this doodad, and I like to call it the butt swing, and this made all the difference in the world. Tell me about this.
Well, it's a pelvic traction. It's a very gentle type of traction. There are many types of traction, but what we do with this is it actually puts you in a posterior pelvic tilt and kind of opens up the spaces in the back between the vertebrae, so it takes the pressure off the nerves, it relaxes the joints, it's very comfortable, and it gives you 20 minutes where you can sit there and just be by yourself.
Right, and relax. And you also would adjust my back. Do you tend to do that with everybody?
My particular practice algorithm is I do a lot of manual therapy because I see that there's a lot of restriction either caused by joint capsule or the muscles around the joint. So I use a lot of osteopathic techniques, which seems to be very effective in my hands working with patients with not just back pain, but it's any type of spine pain.
And also there was the rehab aspect of it all, and I've had other specialists here tell me, build your core. And I didn't listen, and I ended up here. And so you guys have been helping me build my core.
Right, so the core is important, and basically the core is not just here. It's really basically from your shoulders all the way down to your hips. And a lot of folks will start to think keeping their core strong is keeping their shoulders in line with the hips and not twisting. And that's how we kind of basically start, but we don't work that way in real life. We go ahead and we work in diagonals, so we need to go have a strong core and be able to work through diagonals just as much as being in straight planes.
It's very interesting to me because I grew up lifting. I enjoy lifting quite a bit. And you guys taught me all kinds of different exercises, like you said, in diagonals, things that made my shoulder feel stronger along with my stomach and my core overall. It's fascinating to learn all of these things, and a lot of these things you could learn here and take them home with you.
Absolutely. The goal for us is not to have you here for a long time. We want to go ahead and correct the dysfunctions, improve your core strength, your flexibility, but most of all, we want to teach you how to be functional. That's really their 4 stages of rehab. We want to calm the pain down, we want to get it moving, we want to get it strong, then we need to get it functional. That's the part that is the most important because that's what we do in life, is function.
That's a very good point. And we're out here on, is it Clifton Street here?
Clifton Street.
Yeah, but there is many other locations close to you probably.
Yeah, we have 14 different locations in the Central Virginia region, all the way out from Brook Neal to Manita, out in Forest, we're all the way out in Hurt, Virginia. So we cover a large component. So there's probably one of us close to you.
Right, exactly. And the nice thing too is, I just came directly to you. I didn't even need to see my primary care provider. I just said, I think I need rehab, and I did.
Depending on the type of insurance you had, with government insurance, Medicare, Medicaid, and TRICARE insurance, you need to see a physician first. But basically, all other insurance groups can come to us and as an entry level into the healthcare system.
To learn more about Rehab Associates and their many area locations, you can go online to racva.com, check out their Facebook page, or call 855-RACV-4PT. And we'll be right back.